Hello, I'm Gina Ryan, Director of Hardin County Educational and Community Television. Welcome to this edition of EC3 HOSA Medical Moments. One of the reasons that we produced EC3 HOSA Medical Moments is to showcase our students involved in our health science classes. It's one of our most popular pathways at our EC3 location.
So we are so excited. This is our healthcare facility showcase. So our students have worked all trimester, which is 12 weeks, on constructing these facilities and learning the content that goes inside of them. So we have 15 groups here today. The facilities we have are a general hospital, a long-term care facility, community health clinic, inpatient rehab, and a mental health facility. So what is happening today is we've invited fellow healthcare workers, families to come around and check out the models and test our students' knowledge and get more information about their facility.
Our healthcare facility is for mental health, where our mission is to improve the mental health of Kentucky and overall Hardin County, especially through efficient and compassionate care. We want to provide a nurturing environment where patients can heal and thrive at their own pace, and we can help them and guide them through all that.
So what did y'all learn from this project?
I think what we learned is that, as a mental health facility, we want to help others with their mental health and spread the issues of mental health and how we can help them. But most importantly, it's just as a team, we help build this together. We help make this project successful together, and it was just really fun.
Yeah, I think communication was a big part of getting the project together. And as for what we learned about facilities in general, is that they all have the same important key things about how you must treat your patients, policies, safety, things like that, and that it's all the same, just different kinds of care for different kinds of people.
Tell us about the healthcare facility.
This is APRJ Hospital. We serve over 300,000 people, and we're located in Jefferson County.
So we have an ER, that's our OR, a radiology, a laboratory, a waiting room, labor and delivery and recovery. Our mission is to provide and coordinate the best health care in our community, to treat everyone, including patients and their family, with dignity and respect, adhere to ethics, and respond to professionalism.
It's her.
We accept all insurances and are indigent for people who do not have insurance.
This poster is for our safety, or if we had an emergency. If a fire broke out, we use the pass drill, which is to pull, aim, squeeze, and then sweep. To identify a patient, you can look at their their wristband. This is our disaster plan. This is our fire safety measures, I guess. We always encourage hand washing because gotta keep the germs away. And then we focus a lot on body mechanics.
Here's a little Facebook page, and then there's an advertisement page over there.
So what did y'all learn from this project?
We learned how hospitals work and the ethics that are used in hospitals.
Community health is to provide basic health.
And we provide services like pharmacy services, mental health services, and just overall health for low cost. Our model has 2 stories, and they contain both the floors contain a rest area for employees and patients.
What did you learn from this project?
We learned what factors go into working in a healthcare facility and taking care of patients.
This is the Lotus Nursing Home. What else? You want us to talk?
Okay, this is the Lotus Nursing Home. Our vision is to help our senior residents get the care they need and deserve. Our vision is to provide a safe and loving environment for the seniors living with us. Our values are integrity, patience, empathy, and honesty. We will try to make our seniors' adjustment to living with us as seamless and as easy as possible.
I learned how infection control and safety is a really important thing in facilities. I also learned that mental health matters no matter what age you are. Like, that's why we provide a healing garden. Do y'all want to say what you learned?
Pretty much. I learned the same thing. I think it is important to prioritize mental health for elderly patients too.
I learned how our older population also needs more care than the regular population.
I also learned how communication is key with our coworkers.
It's called the Center of Elderly Care. We want to make sure that all of our loved ones are well taken care of, and we're gonna tell you about our facility.
Okay, what makes us so different is that we have analyzed many different aspects of care to ensure we provide best possible care for our residents.
Our facility will be in Sonora, Kentucky, where we believe there is a shortage of nursing homes and where we can make the most difference.
We accept many forms of payments to make it as easy as possible. We accept Medicaid, Medicare, and long-term insurance.
The Center of Elderly Care will be an environment for elderly people or people with long-lasting mental disabilities where they can enjoy their time in peace.
In the model, we made sure to include a full bathroom, a comfortable bed, a living quarters where the residents can socialize, eat, and have fun, like playing games and stuff, and a nurse's first aid station just in case someone gets harmed or needs help.
Our residents will have many things to occupy their time, like board games and recreational activities.
Thank you for your time. We hope you enjoyed our showcase of the Center for Elderly Care.
We learned that it's going to be really hard to work in healthcare, but you have to stay focused and make sure that you really, really stay focused.
I learned that there's not a lot of nursing homes in Sonora.
I've learned that it takes a lot of planning to build a facility like this.
Okay, so this is Harder Unlimited. This is a community healthcare facility, and this is free to everybody.
And we offer checkups, ultrasounds, walk-in, resource office, which Audrey would explain more.
We're located in between Radcliffe and Elizabethtown, and we also have Wellness on Wheels, and we serve everybody. And then a walkthrough of our facility, this would be the resource office that we have, our front lobby, our fire exit, our elevator, our main door, and then if you go up here, we'd have like vaccine and shot stations, and then up here is just a main room for like ultrasounds or anything that's needed.
So what makes our facility stand out is that we have a resource office in there, and it's basically where anybody who may have problems that may be drug use or mental health problems that they need help with, they can go in there and we can refer them out places.
Okay. So we have a Facebook page, and we have Wellness on Wheels, which is something that's under the works, and which would more update would go onto our Facebook page. And our Facebook page just has a little more information if you just not sure if you want to come yet, which we are welcome to everybody.
We try and provide health care to all that is in need of it. We work with Lincoln Trail Health Department and Hardin County Department. We have 2 nurses that work on the Wellness of Wheels and 4 to 5 people that work in the facility.
And how we provide funding for this is that we will do fundraisers that consist of 5K runs, our auctions, and then we'll get a community care grant, and we'll partner with local homeless shelters.
And once again, we're welcome to everybody with insurance. It's okay if you have insurance, but if you don't, you're welcome. I mean, we're welcome to anybody who doesn't or does. But if you do have insurance, for certain things, you do have to pay out of pocket for like shots and vaccines.
Do y'all just want to explain, like, what did you learn from this project, like the whole process of it?
I think we learned how certain facilities really impact the community. Because if we didn't have like community health care, I feel like that people who don't have insurance or resources, then they wouldn't really have a place to go.
So our healthcare project is an inpatient rehab facility, and we focus a lot on trying to provide a very nourishing, caring place for any ages with any injuries.
We also make it to where our patients do not feel left out or they feel like they're at home. So we have activities like outdoor activities, game nights, and movie nights so they feel at home.
I would say that our facility stands out because it's somewhere for easy access. It's we don't care about like strict rules. We let them feel at home a lot, and professionalism is also really big for our workers because we want them to actually care about what they're doing and care for these patients because these patients are going through a lot, so they really need the help. And then our patients, we will have a lot of patients, but we will probably have more workers because it's easier for us to help the patients with more workers because we offer so many extra things like the extra fun activities.
The services that we offer at our facility are things like speech therapy, physical therapy, occupational therapy, and we have rooms that provide stuff for our patients' day-to-day life, and we accept every form of payment like TRICARE, Medicaid, and Medicare.
One thing I feel like we learned was definitely really good communication. I feel like we all kind of went into this not knowing each other and talking through things out, working together, and simply trying to figure out solutions to these answers were something really easy that we learned.
We also learned that we actually have to work on a time crunch, and it's actually really hard. So it's really important to talk and work together, and not so we can actually get the things done.
Monica Hall, health science teacher here at EC3. Currently I'm teaching prerequisite classes and medical math. So I feel like that this trimester the students have maybe moved up another notch with the project. Last trimester was the first trimester to complete the project. Students obviously are nervous today because they're presenting to healthcare professionals and to family members, but I think overall it's been a huge success.
Our healthcare facility is an assisted living facility helping our elderly residents with their later years of life. And we make sure to aim for the sky and the ability to give our residents the best care they could ask for.
We've learned that people in their later years in life don't always have like the best people to help with them, and so we've just learned that it's very important to take care of the older people in your life while you still can.
This is the whole facility. We have the lab here for any tests. We have emergency room for emergencies. We have an elevator to make sure you get there quick and safe, as fast as possible. We have an OR room, an operation room for operations. We have an inpatient room. We have fire extinguishers on each level in case of fire. So we also have fire alarms on each level. We have the X-ray room for any broken bones. We have an emergency exit here and stairs right by it, so we make sure you get out as quick as possible in case any fires. I did not know much about pediatric hospital whenever I first learned about it. Now I know a lot more. I didn't even know it was like for kids, but now I do, which is good. I know about patient identification. I know about fire safety, wheelchair safety, stretcher safety, all the good stuff.
Our healthcare facility is a long-term healthcare facility. It is based off of a historical figure. It is named after Florence Nightingale Nursing Home.
Florence Nightingale was the founder of modern nursing. She provided care to injured soldiers during the Crimean War, and she would carry around a lamp through the dark hallways of the hospital and provide light and comfort to her patients. She managed to lower the death rates of the hospital by 2/3, and she significantly improved the sanitation of hospitals. We're located on Fort Knox,
and we serve anyone who's served our country and like basically anyone who has access to the base, similar to how Florence Nightingale served people who served in the war.
We provide care for elderly, disabled, and people who may need any extra help in living. What makes our facility unique is we have a healing garden. We're located on Fort Knox, and we're inspired from Florence Nightingale. Our patients are well-groomed and have the opportunity for physical and speech therapy.
Our facility accepts Medicare and Medicaid, and we provide walkers, wheelchairs, elevators, and railings for all of our patients.
So this is our waiting area, this is our lunch area, exercise area, this is also where the exit is, stairs, elevator, this is the room, this is the bathroom. We would have around 50 rooms and 20 to 30 staff members.
The poster over here, it would be located in any common areas such as waiting rooms, nurses' stations, cafeteria, and hallways. I have learned a lot about healthcare, actually. The history behind it and different facilities.
Just basically like the things that are important to know, like to have in a healthcare facility, like for safety and like keeping people healthy.
Just like the terms about it, like what do you do in certain situations, and history as well.
I learned to manage your time and work on the more important things before you work on other things.
I learned how to give patients the best care possible and the terms to provide care for our patients.
So our facility is a mental health care facility. It's mainly focused on veterans who are dealing with suicidal thoughts, PTSD, anything like that.
At our facility, we offer group and one-on-one therapy, outpatient and inpatient care, medication, and a peaceful scenery for activities such as yoga and art therapy. We also offer telehealth for patients who can't travel.
We've learned a lot about how mental health facilities actually function and how there are things like code of ethics and infection control and safety and all of that works. And we've also just learned a lot about dealing with patients who do have mental issues, and we really just want to help them.
We've also learned all about time management and what has to get done in a certain amount of time, and then teamwork, obviously.
Our facility is a pediatric hospital. Our mission is to assist every child's health and well-being. Today we invite you to explore our services and care. Our goal is to ensure that all children receive compassionate and supportive treatment. At Bowman's Pediatric Hospital, our mission is simple yet sincere, to provide care with empathy and skill. We envision a future where every child has the ability to be provided with dedicated care that is essential for the children's growth.
We serve both children and young adults. We provide care 7 days of the week, 24 hours a day. We don't care of your family background or medical history. We will serve you regardless. We also make sure that our medical staff provides care with sympathy and professionalism. We provide bright play areas so the kids feel comfortable, and we also have comfortable patient rooms. Our staff always makes sure to go above and beyond.
We understand that every patient may need different and special care. We offer a variety of services that include routine checkups, vaccinations, surgical procedures, and so forth. We understand that healthcare cost is overwhelming, so we offer Medicaid for low-income families, so you guys won't have to worry about struggling for payment. Who's for?
Our team is composed of highly skilled professionals, including physicians, nurses, therapists, and encouraging staff members. For our 50-bed facility with anywhere between 150 and 200 employees, including administrative, maintenance, housekeeping, laundry, RNs, LPNs, CNAs, therapy, OT, and speech therapy.
Right here is where our lobby starts. You'll be meet with affectionate staff members that will help you with any of your concerns or issues. Each of our rooms have been designed for a childlike view to accompany them with vibrant decor, cozy bedding, and age-appropriate equipment to help them feel at home during their stay. For our youngest patients, we offer specialized units like the NICU and PICU. Our skilled team of physicians and nurses provide round-the-clock care to ensure the best outcome. We offer a wide range of outpatient services from our pediatric emergency department to diagnostic imaging to therapy rooms to play areas. Our facility is to provide a child-friendly environment. Right here, we have ways to identify the patient. We can check their ID. We could call their name at least once or twice. We can ask another individual. We could get a photo verification. We could get their recorded number on their wristband that they would usually have. Here's the material safety data sheet. The data sheet that provides information on chemicals, dangers, the company's identification handling.
So right here, it tells us the 3 things needed to start a fire, and right here are the 3 steps for disaster preparedness.
Okay, excuse me. Okay, here we have the chain of infection, which is how infection moves around, and that would be infectious agents to reservoirs to the portal of exit, and then so on and so forth. Over here, we have how to properly wash your hands, because hand hygiene is the most important way to avoid infection. And we have steps, and we have wheelchair and stretcher safety for patients.
Okay. So right here we have PASS. So in case there was a fire in the hospital, to use the fire extinguisher, you'll pull the pin and you would aim it at the base of the fire. You squeeze the handle and then you speed back and forth to have the fire go out.
This is RACE. These are the steps known to take when in a fire: rescue, alert, confine, and extinguish.
Okay. Thank you for taking time to explore Bowman's Pediatric Hospital. We hope our tour has provided insight to our empathetic care and services we provide for kids and their families. Our mission is to make a positive difference in the lives of children, and we are dedicated to upholding that mission each and every day.
Today we will be showcasing our mental health facility located in Elizabethtown, Kentucky. We serve mentally compromised individuals. Our mission is to provide state-of-the-art care for any and all mental health needs. Our vision is to better the lives of those who struggle with mental illness. We value our patients' well-being and overall care.
Our facility stands out because of our attention to patients and our expert staff. We strive to provide a safe, beneficial environment for all our patients. For example, on our poster, we have RACE and PASS. Our staff is some of the best you can find. They strive for excellence. We offer mental health and substance abuse counseling. We treat all mental health issues. We accept Medicare, Medicaid, TRICARE, private insurance, and private payments.
We have 135 employees. We have a 1-to-4 patient-to-employee ratio, and we do meetings and human resource informational classes for our employees. In our model, we included a patient's room, a recreational area, a therapy office, and cafeteria. We have elevators, stairs, and a little bench.
Okay. So on our flyer, we have our mission statement, which is we strive to provide state-of-the-art care for any and all mental health needs. We put our patients first. It has our phone number and our address and our policy of no visitors allowed to protect the confidentiality and safety of our patients. On our Facebook page, thank you. It also has our mission statement, and then it has our services, our newsfeed, and more. We have several activities like arts and crafts, which is featured on our Facebook page, and our group activities and games for our patients. We hope you enjoyed our presentation we've put together. Thank you for your time. Does anyone have any questions?
We've learned a lot about the logistics of having a facility. We learned about different employees, different requirements that you had to have, different laws that were, you needed to follow by, but also about the kind of individuals that wouldn't necessarily apply to this sort of facility.
Okay. We're Hopeful Horizons Care Center, a long-term care facility for seniors and patients requiring assisted living. We're located in Florida, and our employees specialize in palliative and geriatric care. They're dedicated to providing quality care to make your loved ones as comfortable as possible during their stay. As you can see here, we have the lobby and a front desk sign-in to check in patients with an at-hand nurse for 24-hour supervision. We have exits posted, fire hydrants, first aid kits, no smoking signs, all posted around the facility to ensure no accidents. We have a medicine room with a physician at hand and private patient rooms to make them as comfortable as possible during their stay.
As previously stated, we are located in Florida, and our specific address would be 1706 Green Grounds, Happyville. Since we are a geriatric care center, we want to attend not only our patients, but also the visitors we allow them to have for 14 hours out of the whole day. Open from 7 a.m. at night, 7 a.m. in the morning to 9 p.m. at night. We have 19 employees as listed. They are 3 physicians, 2 therapists, 8 nurses, 4 administration, and 2 custodians. And we have 20 employees. So our ratio is pretty good. We want to show everyone respect and patience. And at Helpful Horizons, we always stay calm and collected no matter the situation, and we always know what to do if anything ever happens.
Hopeful Horizons' mission is to make sure our residents know they have a loving home and a family when they enter our facility. We value having happy residents that are comfortable with not only our staff, but with other residents in the facility as well. We vision to make sure our residents are the happiest they can be, and we plan to accomplish this by making sure our staff are held accountable for their actions when they are working. And we also like to have our staff and faculty with professional attitudes. Our facility offers many services that include nurse assistant, warm meals, 24-hour supervision, assistance with everyday living, rehabilitation services, cozy private rooms, and we even have an on-call physician.
Our outstanding level of care we provide to our patients is what makes us stand out. All of our patients are well taken care of by our amazing healthcare professionals. We accept all forms of payment, including Medicare, Medicaid, and private pay. This is our advertisement, which displays the services we offer, a brief description about us, and our information, including the location and how to contact us. This is our Facebook page, includes our About page, the services we offer in a news feed. Our news feed is updated weekly and includes activities such as weekly bingo nights. On Fridays, the seniors read to kindergartners, and we have a veteran party that celebrates the veterans living within our facility. This is it for our presentation, and I hope you enjoyed our presentation, and we look forward to serving your community.